So thank you for joining us for the More Than Sad session brought to you proudly by the Health Department with support from our Maternal Child Health Grant. It's an honor to have Sara Kohlbeck here from the Medical College of Wisconsin, and she's going to talk a little bit about this wonderful suicide prevention program.
Great, thanks, Melissa. So my name is Sara Kohlbeck. I am the president of the board of the Wisconsin chapter of the American Foundation for Suicide Prevention, and I'm also the director of the Division of Suicide Prevention at the Medical College of Wisconsin. And I'd like to thank you for participating in this educational program, More Than Sad, suicide prevention education for parents, teachers, and adults. Really happy to be here and be able to be part of this in this community today. Before we get started, I just want to note, obviously this presentation is going to discuss topics related to suicide, and that can be a sensitive and sometimes difficult topic to discuss, but talking about suicide is critical for prevention and helping to break the stigma. And so we're really grateful that you've joined us for this important conversation. If at any point during the presentation you feel like you need to take a break, feel free to do that, hit pause and come back, and we will still be here. Overall, I hope that you are able to learn more about suicide prevention from today's presentation, specifically suicide prevention among young people, and become more comfortable talking about this important issue. So just to get started with some level setting about language. How we talk about suicide matters, and it matters for a few reasons. First of all, we don't want to contribute to stigma around suicide by using language that's judgmental. And also we want to make sure that we are encouraging folks with lived experience to talk about their experiences as they are comfortable. And so using non-stigmatizing, non-judgmental language is really important. We want to model that language. So when we talk about suicide, we avoid using the phrase committed suicide. And that is avoided because it can have a negative connotation and it can imply a sin or a crime. Instead, we encourage the use of plain language phrases that are very objective, died by suicide, ended his or her life, killed himself or herself, just very objective, kind of, as I said, non-judgmental phrases. Also, when we talk about suicide and suicide attempts, we avoid referring to those attempts as either failed or successful. Not only is that language unnecessary, but these words imply judgment. And so instead, we just encourage, again, very plain language terms such as suicide attempt, suicide, or death by suicide. And educating the public about suicide is critical for encouraging help seeking, raising awareness of risk, and advocating for new programs and intervention strategies. And so when we talk about suicide safely and accurately, we can actually help reduce the likelihood of its occurrence. So in today's presentation of More Than Sad, we do have several goals that we're going to go through. We're going to be looking at suicide risk and mental health in youth and young people. We're also going to work through identifying warning signs and risk factors for suicide in teens and young people, and then look at the role of mental health care in reducing those risks. And then finally, we will discuss ways to start a conversation with a young person about suicide and mental health. Before I get started, though, I'd like to go over just a couple of key terms. You can see those here on the screen. So the first term is suicidal ideation. And that just means any act or behavior that can lead up to a suicide attempt. And typically ideation involves thoughts specifically versus behaviors, which is the next bullet point. And again, those are behaviors related to suicide and can include anything like a preparatory act, something like purchasing a firearm with intent to use it in a suicide attempt, or even researching methods of suicide attempt online. Those are considered suicidal behaviors. We also have non-suicidal self-injury, We know that not all self-injury brings along with it a suicidal intent. And so non-suicidal self-injury refers to those acts where there is no intent to die, such as cutting, burning, and scratching. Often folks that engage in non-suicidal self-injury are doing so as a method of coping, but they don't actually have any intention of taking their life. On the other hand, when someone makes a suicide attempt, there is intent to die. These attempts may or may not result in physical injury, but the intent to die was present. So that's how we kind of distinguish that from the non-suicidal self-injury. And then finally, suicide is defined as a self-directed, injurious behavior with the intent to die that results in death. So I want to set the stage a little bit and provide some context to the information that we're going to be talking about today. And we're going to start by getting an overall sense of the scope of suicide. The information here on the screen is from 2019, so it's a bit dated, excuse me, but in 2019, there were about 47,500 reported suicide deaths. That number, unfortunately, has increased. We see in some provisional data released by the CDC, we do see a slight increase in 2021, but those data are being finalized. That works out to a suicide rate of about 14 suicides per 100,000. And at that rate, suicide is the 10th leading cause of death in the population overall. We also know that about half of all reported suicides are by firearm. That is actually higher in other populations. Veterans, for example, about 70% of veteran suicides are by firearm. Locally here in Wisconsin, much of the work that I do is on farmer suicide, and about 70% of farmers who die by suicide use a firearm as well. When we zoom in and look a little closer at young people ages 10 to 24, there were just under 7,000 suicide deaths nationally in 2019. And youth suicide comprised about just under 14% of all suicides in the United States. Suicide is the second leading cause of death among youth ages 10 to 24, just behind unintentional injuries like motor vehicle crashes. With this information, it's also important to note that death by suicide is pretty rare, and any sort of death by any cause is fairly rare among youth ages 10 to 24. So it's a relatively rare outcome. The other thing I just want to highlight is I want to stress the word reported. You can see it in italics on the screen because suicide has been historically underreported. This is the case across the world and in Wisconsin and in the United States as well. There are many reasons why this is the case. Stigma might be one of those cases. Sometimes the stigma surrounding a suicide makes families hesitant to classify death as a suicide. And also the cause of death can be difficult for a coroner or a medical examiner to determine. Typically, unless there is really overt evidence that a death is a suicide, it's difficult to determine that. So if there's not a suicide note or something similar, it's a little bit more difficult to determine. So this graph shows the suicide rate across the lifespan. So on the bottom, on the x-axis, are ages 1 through 85. And on the y-axis on the left are suicide rates per 100,000. And you can see that rates of suicide in those under age 10 is actually quite rare. It's a very rare outcome, although we are starting to see suicides in children as young as elementary school aged. But it's fairly rare in comparison to other groups. And then suicide rates increase more dramatically during adolescence, starting at about age 11 and through early adulthood. And they rise more dramatically during that time period than any other period or any other stage of the life cycle. In particular, we see rates raising dramatically between ages 12 and 22. And you think about all of the different stressors, all of the changes that are happening in a young person's life during that time period. And unfortunately, we see that manifested in increased suicide rates. I do also want to point out that suicide rates for adolescents and young adults are quite a bit lower than those for people in midlife and elder age groups. In Wisconsin, the suicide rates are highest among those ages 45 to 54. And then we do also see an increase in suicide rates in individuals ages 75 and older. So, obviously different life stages, different stressors, different experiences. And unfortunately, at different points of life, that contributes to increased risk for suicide. So for this graph, I just want to note that suicide rates and mortality rates in general are calculated in number of deaths over 100,000 people. And that's just done so that we can have a comparison between groups. And it's important to keep in mind that a group can have a high rate and yet not account for the highest number of suicides. And that's just because there are fewer people in that population. So as you can see from the graph, the rates of suicide have gradually increased over time until 2019. And then we saw, for the most part, rates stayed the same or declined slightly. That actually was only not true among folks ages 85 and older. There has also been a slight increase in the suicide rate for individuals under the age of 15 to 24. And you can see that in the brown line on the screen over the last 15 years. And it's important to note that because deaths by suicide in this group are pretty uncommon, small changes in the number will have a marked difference in the rate. The suicide rate for youth under the age of 15 is the orange line on the bottom, and that is by far the lowest in incidence. I will note that there has been a slight increase over this time period, though, and you'll see that on the graph. However, the loss of a young person under the age of 15 can also impact an entire school and a community and put peers and other children at risk. And so that's where this presentation hopefully will help. We're going to be focusing on suicide prevention among youth and young people. There's a lot of room for intervention in this age group. And so learning a little bit more about suicide prevention in this age group is one step toward helping. Another way that we look at suicide rates is by sex. The information on this screen shows suicide rates from ages 10 through 24. The blue lines in the graph are males and the yellow lines are females. We can see that starting at age 12, there's actually little difference between the suicide rate for males and females. But then as age progresses, for example, as we get to age 18, the rate for males is 5 times higher than the rate for females. This difference between the sexes persists through young adulthood, peaking at age 22, when the male suicide rate is more than 6 times the female rate. And one question that folks might ask is, why is there a difference between genders or between sexes in terms of suicide rates? And there are a couple of reasons why this might be the case. First of all, it is typically in our culture more acceptable for females to seek help. We tend to stigmatize help seeking among males in our culture. And so there might be less help seeking that contributes to increased suicide rates. We also know that males tend to use more lethal means in suicide attempts than females. Males typically use firearms much more often than females do. And we know that about 90% of people who attempt suicide with a firearm will go on to die by suicide. That's in comparison to suicides from an overdose or hanging, where the fatality rate is about 20 to 30%. There's much more time for intervention. So that utilization of more lethal means among males may also contribute to the higher rates of suicide. When we look at youth suicide rates for those ages 10 to 24 by ethnicity and by race, we see that Native Americans actually have the highest rate of suicide nationally, and that's also the case in the state of Wisconsin. Native American youth have the highest rate of suicide, followed by white non-Hispanic youth, Asian Pacific Islander youth, and then Black youth. And then when we look at ethnicity, Hispanic young people have a suicide rate of about 7.54 per 100,000, which is actually the lowest among our race ethnicity groups. But as we know, data from more recent years, 2020 and 2021 is still coming in, so this might change. We know that when we talk about suicide as a health problem, death by suicide is really just the tip of the iceberg. There are also other outcomes related to suicide that kind of fall below the surface. And one of those outcomes is suicide attempt. The CDC gathers hospital admission data for non-fatal injuries. And that's one way that we can look at data around suicide attempts. And we can see that for young people, this data tells us that there are an estimated 100 to 200 suicide attempts that require medical attention for every reported death by suicide. We also know from the Youth Risk Behavior Survey that about 2.5% of youth in high school grades reported making a suicide attempt that required treatment by a doctor or a nurse. And I also want to say that this is an underestimation of the actual burden of suicide attempt, because we only have data for individuals who are seen in the hospital for self-inflicted injury. Many suicide attempts do not require medical attention, and so many individuals who attempt suicide don't go to the hospital and therefore are not reflected in this data. Excuse me, we also know that youth are more likely to survive suicide attempts because they live with people, parents, caretakers, other siblings that can rescue them if they do attempt. Youth have healthier bodies than older adults do and are a little bit more resilient physically. And they also have less access to lethal means. Typically adults have more access because they own a firearm or they have medications, other lethal means in their home, whereas youth are less likely to have access to those means. The National Youth Risk Behavior Survey also monitors health risk behaviors that contribute to leading causes of death. And we have information on suicidal ideation as well as suicide attempt from the Youth Risk Behavior Survey. And according to the most recent survey, about 19% of high school students reported having seriously considered attempting suicide in the previous year. About 16% reported having made a plan for a suicide attempt. And then roughly 9% reported having attempted suicide one or more times in the past year. I also want to note that we see health disparities in this data. LGBTQIA+ youth have higher rates than heterosexual youth of both suicidal ideation and suicide attempt. And we also see that youth of color have higher rates or higher proportions of suicidal ideation in the state of Wisconsin specifically. So when we hear a young person speak of wanting to take their life or indicate that they are thinking about suicide, we must take it seriously every time. Adults, other people may think that teens talk about suicide for attention, but it's important to take all threats of suicide seriously until the young person is able to be seen by a counselor or a healthcare provider so that there is time to intervene. So we're going to shift focus a little bit now from data and talk a little bit about risk factors for suicide. Focusing on mental health conditions like depression or anxiety or other serious mental illness is essential when we talk about suicide, but it does not give us the full picture of the complexities of suicide risk. Risk factors are elements that are present in a person's life that increase risk for suicide. Having one or more of these risk factors does not mean that a person is going to go on to die by suicide, but it does mean that there needs to be extra caution. The main risk factors that we see can be grouped into three categories. The first is health factors, which include biological and psychological aspects of a person's health, including the presence of a mental health condition. Historical factors, or things that happened in the person's or the family's past history, are risk factors. And then we have environmental factors that include societal and cultural factors, including access to lethal means, as well as individual life events. In general, risk factors are longer-term issues that signal the need to be as proactive as possible when it comes to mental health and wellness. But as I said, the presence of risk factors does not indicate that an attempt will necessarily be made. Research has shown that many people who die by suicide across the lifespan have a treatable mental health condition at the time of their death. This is just the same as other health conditions. Early identification and treatment of this mental health condition can save lives. Recent research has also shown that, as is the case with what we know about those who attempt suicide at all ages, young people who attempt suicide do so as the result of many factors. So suicide is not the result of one factor, it's the result of many factors coming together in a person's life to create a situation where they are experiencing very acute and difficult psychological pain. Suicide risk in teens is most clearly linked to mental health conditions, which can occur together, which would increase risk further. Major depressive disorder is the mental health disorder that is most associated with suicide across the lifespan. And we know that depression can co-occur with many other mental health issues, including anxiety, eating disorders, and substance use disorders. And again, when there's co-occurring mental health conditions, that can increase risk further. Many people who talk about suicide among youth talk about bullying as a factor that precedes or contributes to suicide. And research shows us actually that the relationship between bullying and suicide is complex. When other risk factors are present in a young person's life, being bullied can be a precipitating factor or stressor that can increase risk further. And that's because research indicates that persistent bullying can lead to or worsen feelings of isolation, rejection, and despair, as well as depression and anxiety. And all of these things can contribute to suicidal behavior. But an interesting thing is that bullying behavior also indicates underlying risk in the bully. So it's not just about the bullying victim, it's also about the perpetrator. Any involvement in bullying behavior, whether as the bully or the victim, is a stressor, which may significantly contribute to feelings of helplessness and hopelessness that raise the risk of suicide in teens. That being said, however, suicide is not a natural response or a reasonable solution to bullying. Bullying is one factor, but does not directly result in suicide. And suggesting that is the case could actually increase contagion. It's important to note that the large majority of people who experience bullying do not become suicidal. Another important consideration in the context of youth suicide is social media. And the research in this area is emerging as social media continues to evolve. Some people utilize social media with a mixture of positive and negative effects. I think that's the case for youth and adults. But for young people with risk factors for suicide, including depression and anxiety, social media can have negative effects on their mental health. So it's important to note that young people may also use social media to reach out for help or to indicate their distress behaviorally or verbally. In that way, social media can be sort of a protective thing as well, if that is a connection to one's social support network. And at the same time, as I mentioned, it can be an indication of suicide risk, particularly if their usage of social media changes drastically, or they start to make statements on social media indicating a desire for suicide or to die or to escape their pain. So just like we encourage young people to alert adults if they notice or hear these things being said, they should also be encouraged to notify an adult if they are concerned about a peer's social media posts. So I am going to show a clip of AFSP's Chief Medical Officer, Dr. Christine Moutier, who will talk a little bit more about the risk factors and warning signs that contribute to suicide risk.
It's not just about whether life is worth living. Suicide is a health issue, and it's largely preventable. Suicide happens when multiple factors come together, so it's not related to just one cause. You can think of the underlying risk factors for suicide in 3 different buckets: biological, psychological, and past history. Biological risk factors for suicide include things like mental health problems, like depression, anxiety, or substance abuse. Those are all risk factors for suicide that underlie and may not have even been recognized at the time the person dies by suicide. Psychological traits that present a risk for suicide are the tendency to interpret life's events in black and white or catastrophic ways, to be impulsive, aggressive, or extremely perfectionistic, and those don't allow us to be as flexible and to cope quite as well with life stressors. Past history can really put somebody at risk for suicide in a way that becomes an invisible layer because it might have happened many years ago. Things like a past history of childhood abuse, or a past history of severe brain injury, past history of personal suicide attempt, certainly, or a family history of a suicide. Those are all historical events that place a person at higher risk for suicide. On top of all of those underlying risk factors that can be quite invisible to people around that person, of course, there are life events going on for all of us, stressful things that we're dealing with. And so for individuals who have some of those underlying risk factors, those stressors that they're facing in their current day life can absolutely precipitate a crisis. One of the biggest risk factors when it comes to suicide are mental health problems. What research shows is that 9 out of 10 people who have died by suicide did have a diagnosable mental health problem at the time of their death. It may or may not have been recognized or been treated. And so that means we really need to look out for one another. We need to learn the warning signs for suicide risk and know what to do when we see that. Just like we do for CPR or first aid, we can recognize when somebody is suffering from a heart attack or another physical illness in a crisis. So some of the warning signs for suicide are changes in behavior. The people around you that you've gotten to know well in your family or in your friend group, they have patterns of behavior. And when those patterns change significantly, take note of that. Speak to them if you're concerned. Some of those symptoms look like changes like this: withdrawing socially, isolating from you or from their normal life's activities, becoming agitated or easily angered, which we don't often associate with depression or suicide risk, but agitation absolutely is a very common experience when it comes to people who are feeling suicidal. Increase in anxiety, changes in sleep patterns or appetite, those are all warning signs that the person's mental health is deteriorating. Certainly, if they begin expressing any thoughts about life being not worth living or thoughts of ending their life, or even if they're not saying it, but they're doing things that seem odd, like giving their belongings away, those should all be taken very seriously. And if you notice things like that, certainly speak to the person in a caring way, and you can also lead them to help. Unfortunately, there's a lot of stigma attached to these kinds of experiences that relate to mental health. So many of us actually hide or cloak the distress that we're in. We keep our experiences very internal rather than reaching out and connecting with support. We need to do everything we can as the role that you have in your family and in society to shatter the stigma, to talk about mental health as any aspect of health like any other, and to approach people that you're concerned about and be open with what's going on in your own life as well. Having the risk factors that I just went over does not mean that a person will die by suicide, but it does mean that we need to do a better job of looking out for one another. There are also protective factors that come into play and that we can think about shoring up for ourselves and helping our loved ones to improve upon as well. Those protective factors against suicide risk include things like feeling connected to your family, to friends, and to your community. Having a regular source of health care, including mental health care, and feeling supported in that. Learning good coping strategies in life is very important, and we can start teaching our kids that at a pretty early age. The last protective factor is knowing the signs that you are needing to seek help. It's the smart and courageous thing to do. It's not a sign of weakness to reach out and get help when you need it.
All right. I'm going to transition back to my slides here. So talking specifically about young people, it can be easy to mistake mental health symptoms for other typical youth behaviors, such as normal adolescent mood swings, laziness, poor attitude, or immaturity. But that being said, these perceptions that adults have of them may inhibit young people from seeking help, which is why it's important to take talk of mental illness or suicide seriously. And so when you notice a change, it never hurts to have a conversation with a young person about what you're seeing. You might also want to help that young person speak with their doctor or a family doctor or a counselor about the changes that you're seeing as well. So the risk factors that we talked about earlier can be subtle to detect, and having lots of risk factors doesn't necessarily mean that someone is having thoughts of suicide. For example, high cholesterol and heart disease may run in your family, yet that does not mean you are that you have heart disease or that you're currently having a heart attack. On the flip side, warning signs that we're going to talk about now are observable signs that someone may be at imminent risk for attempting suicide. Sometimes we will hear the warning signs and what is being said. We should listen for statements such as, I should just kill myself, or I've got no reason to live. Everyone would be better off without me. There's no way out of this. I can't live like this anymore. I can't take this pain anymore. And they may say these things to you in person, or they may post things like this on social media. And it's important to not assume that they're joking and to always start a conversation with somebody. And we'll talk about how to do that in just a bit. A person's suicide risk is greater if a behavior is new or has increased or changed, especially if it's related to a painful event, a painful loss, or a major life change. So we want to look for things like increased alcohol or drug use, online searches for suicide methods, acting recklessly, such as driving too fast or engaging in risky sexual behaviors, withdrawing from usual activities that might be extracurriculars or sports or clubs or other activities that youth are usually engaged in. Isolating from family and friends, and that could include going silent on social media. Individuals in distress also can develop insomnia or can actually sleep more, almost appearing to hibernate. And if there's a sudden change in either direction, with either sleeping too little or too much, that's something to take notice of. We also see people saying goodbye or giving away prized possessions, and we don't want to ignore that sign. And then finally, increasing aggressive behavior and picking fights is another warning sign that's often missed. So if you have a young person who's usually easygoing and peaceful and all of a sudden becomes really aggressive or violent, it's time to take notice. Sometimes our best indication that someone could be at risk for suicide is a sudden change in mood. We want to watch for things like depression, loss of interest, anxiety, increased irritability, shame, humiliation, or extreme embarrassment, agitation, or rage. Also, sudden unexplained happiness can be a sign that an individual has decided on a suicide plan and is relieved that they will no longer be in pain. Again, it's really important to just take notice of things that are drastically out of the norm for somebody. And when we see these warning signs, it's time to start a conversation. So I am going to skip a little bit and talk a little bit about mental health treatment and how it can be helpful for suicide prevention. So research has shown that 2 out of 3 teens and young people with depression don't get treatment. And this could be for any number of reasons, including stigma and access to services. However, we know that mental health treatment can work in terms of suicide prevention. And although treatment varies by person, it really depends on what's helpful for the person and their condition and the severity of their condition. Young people who show signs of depression can show improvement in 4 to 6 weeks when receiving psychotherapy or talk therapy. And for other people, adults included, the combination of talk therapy and medication can make a significant difference. It's not always an immediate difference, but within 4 to 6 weeks, you might start to see improvement. The other important thing about youth is that many young people benefit tremendously when family engages in therapy together for a period of time. So there might be time when the young person is in therapy by themselves, but then bringing the family together for therapy is also beneficial. We know that treatment can make all the difference in short and long-term symptom reduction and in overall health. Treatment is effective for most people that have a mental health condition, including depression. Treatment for depression can vary in length and in nature. For some, depression is kind of a one-time thing from which they will recover, though episodes can reoccur. And for those folks, treatment will be in response to the symptoms during each episode. For others, depression may involve multiple episodes and will be addressed more like a chronic illness, like diabetes or cardiovascular disease. In these instances, it might be recommended that treatment continues to help prevent problems in functioning. So that's why it's important, if you have symptoms of a mental health condition, to be evaluated by a trained professional so that treatment can address the core health problem as effectively as possible. And just like other chronic health conditions, healthy habits can alleviate some of the symptoms of mental health conditions as well. And this is going to look different for everybody, but some things that can help include things like exercise, yoga, breathing exercises, a regular sleep schedule, and a healthy diet. These things can improve moods and relieve anxiety and stress. And again, this is going to look different for everybody, but creating healthy habits as a family will benefit everyone. Seeking a mental health professional can be a critical part of treatment. Oftentimes when children and young people are faced with a mental health issue, it can be kind of scary to seek help from a mental health professional. So it's important to make sure that your child feels like he or she can talk to the therapist or the professional. And if it's not a good fit, to try another professional. Make sure the mental health professional has the information that you have about the young person's behavior, especially if they're having any thoughts of suicide. And also be sure to report any unusual behaviors, suicidal thoughts, or any substance use. It's important to be vigilant if medication is started or if there's a change in existing medication. Sometimes those medication changes can be a little bit difficult for a time, but it's important to stick with it because going off medication suddenly can also be very problematic. And then stay in contact with school counselors as appropriate if it's going to help with their academic health and their context. And most importantly, be patient with the young person. It does take time often for treatment and or medication to kind of kick in for a young person. So it's important to remember to be patient. As we discussed earlier, although treatment is effective in most cases, about 80% of cases, there are some common barriers that get in the way of treatment for young people. And that is really behind only 1 of 3 teens and young people experiencing a mental health crisis getting the help they need. Sometimes the symptoms that they're having aren't recognized as signs of a possible health condition, and they're dismissed, even by the person that's experiencing them. There's also, as I mentioned, fear of what treatment might involve. And we can help sort of dispel those fears by making that information that we provide to young people. Sometimes there's an overall sense of despair or hopelessness, which are both symptoms of depression that can lead someone to not reach out for help. So again, helping to combat those thoughts can be helpful. When we don't see help seeking as a sign of strength, we can really discourage help seeking. And so creating a culture within our schools and our communities that reaching out is socially acceptable and is truly a sign of strength will be helpful for young people. The other thing is that teens generally believe, and young people generally believe, that adults won't understand their problems. So they don't reach out because they don't feel like they'll be understood. And then young people often don't have the means or access to resources to seek help for themselves. They may not be able to afford treatment without their parents' contribution or have no means of transportation to access treatment. So again, helping to promote and provide access to these resources will help young people. There are many things that you can do to help your child or a child that you are in contact with stay safe and help reduce the risk of suicide. Number one is making sure that your child or young person is receiving mental health care when needed. That can help a great deal. I know that there are shortages of mental health providers in communities, and I'll be providing some resources at the end of the presentation that are informal, more peer support services that can be accessed in times of need. We also need to foster strong connections to family, friends, schools, and the community that help to foster resilience. And schools can do a lot of work in this space to create safe and supportive and nurturing environments for young people. It's also important to maintain a safe and supportive home where it's always okay to reach out for help. And then limiting access to lethal means is also important. That we'll talk about more in just a second. We want to be able to nurture problem solving and good communication skills and treating disappointments as learning opportunities. And then don't be afraid to ask your child or a young person about their mental health. Ask them about how they feel in response to different events, and then model expressing emotions. For example, you might say something like, "I felt sad too when that happened," in response to a sad event. We want young people to see adults modeling good coping skills and modeling talking about their own mental health so that they see that it's okay. And then, as I mentioned, it's important to reduce access to lethal means. For example, about half of suicides occur with a firearm. And so temporarily storing or removing access to guns in the home can limit a young person's ability to use it as a means of suicide in times of an intense emotional crisis. You can be a role model for a young person because depression and anxiety, other mental illnesses can be recurring or chronic. Having an early conversation about depression or other mental health issues can help set the stage to address future difficulties if they occur. Think about diabetes, for example. We would not wait until a loved one was in a diabetic coma before getting treatment. The earlier that issues with blood sugar are addressed, the less likely the disease will become life-threatening. And so in the same way, adults need to show that they believe it's okay to ask for help for themselves. Parents, teachers, other trusted adults can be important role models for help seeking, because it's hard for a teen to believe that help is available or appropriate if they don't see adults around them believing it. So how do you reach out to your child or someone else, another child or young person that might be at risk? First of all, it's important to talk to them in private, take them aside, into a place that is safe, and ask them privately how they're doing, and listen to their story. Oftentimes when somebody is concerned about another person, it can be kind of a scary situation, but taking a deep breath and listening to their story in a way that's non-judgmental and expresses concern and caring can be very helpful. We also want to ask directly about suicide in a calm, non-judgmental way. And that involves asking a direct question like, are you thinking about killing yourself? And then if they indicate that they are, reassuring that person that help is available, helping them feel a sense of hope in that moment, and then taking them to treatment if necessary. Something that I always tell people is to trust your gut. Oftentimes when we see people who have died by suicide, unfortunately, there are a number of people that saw signs prior to the suicide, but either felt embarrassed or didn't feel close enough to the person to take action. But it's important to assume that you're the only one that's going to reach out. So a good rule of thumb is to trust your instincts. And if you're wondering if a young person is overly anxious or depressed or potentially suicidal, that's a sure sign that you should start a conversation and let them know that you're concerned. If you're noticing something, don't wait for the young person to reach out or for the school to do something about it. It's important to be proactive. And the other thing is, sometimes people don't respond the first time that you reach out, but it's important to not give up, reach out again, and keep trying. There are some less helpful things to avoid when talking with someone who might be suffering in a suicidal crisis. First of all, we want to avoid minimizing the young person's feelings. Those of us who have never experienced major depression or anxiety literally cannot imagine what it feels like. And it's not fun to hear that those we love are suffering, especially when it's a young person, but minimizing their feelings isn't helpful. We also want to avoid getting into philosophical debates and avoid trying to convince them that life is worth living. When a person is nearing a crisis point, this type of discussion is not going to be helpful. Nor is it helpful to point out all the good things you see in their lives. You can save those conversations for when the crisis has passed. And then finally, avoiding advice to fix it. For example, if a person is having a heart attack, you wouldn't tell them to start exercising or to eat a healthier diet. If a person is in crisis, what they really need is to be heard and understood and cared for. So listen to their story, and if they would like, offer to help them find a health professional. Here's a few things to remember when talking to a young person. It's important to take it seriously and don't wait to act. Asking the direct question, have you ever felt so bad that you have had thoughts of suicide? Or are you thinking about suicide? Asking these questions will not put the thought in the young person's head if they aren't already thinking about it. You might want to identify a helping adult prior to having the talk, like a professional, but what is the most important is that you reassure the child that you are going to get help and then don't wait to do it. You might also want to enlist the help of others who interact with the young person, including teachers, counselors, coaches, to see if they have noticed any changes in behavior. And just remember that a stressor that might seem small to you is not small to a young person. It's important to validate how that person is feeling about their current situation, even if you might see the situation very differently. So there are some steps that you can take if your child reports thoughts of suicide, or if you suspect that a child or a young person might be feeling suicidal. Even though it's hard to do because this is a scary situation, stay calm. Let the young person know that they did the right thing by thanking them for having the courage to tell you about their thoughts of suicide. Then reassure them that you are going to get help. Oftentimes, sitting with that person and letting them talk through their feelings in an open and honest and caring way can help to really de-escalate the situation. But then follow up with a professional for an evaluation appointment as soon as it's possible. We want to reduce immediate stressors when possible. This might include things like taking a sick day from school, missing football practice, something like that. A good rule of thumb is to think of what exceptions you would allow if a child had strep throat or a broken bone. And finally, take a moment to secure the lethal items in the home environment. Make sure that any firearms in your home are secured and stored separate from ammunition or temporarily held by another person until the crisis has passed. It's also important to lock up medications or other items your child has mentioned that they might be using. Make the environment reasonably safe for as long as necessary. Sometimes the crisis point has been reached and scheduling an appointment a few days from now or a few weeks from now is not enough. So if your child is in crisis or if a young person is in crisis, you need to take action immediately. And you might discover that a young person is in a crisis situation if they maybe have told you that they have planned out how they would kill themselves, or you discover a suicide note either on social media or text message or on paper. If your child or a young person reports hearing voices telling him or her to kill himself or herself. If you discover that that the young person has made a non-lethal suicide attempt, or if you just feel in your gut that the young person is not safe and are afraid to leave him or her alone, those are signs that you might be in a crisis situation. And if that is the case, the most reasonable and responsible action is to get help from a trained professional who can assess the young person and help you figure out next steps. One thing that you can do is take them to an emergency room or a mental health center for emergency evaluation. If that's not possible, you can always call the National Suicide Prevention Lifeline. The 800 number here on the screen is still active and available to call. However, as of July of this year, there's now a 3-digit number that you can dial, which is 988, and it will connect you with the same professionals at the National Suicide Prevention Lifeline. An important consideration is to not leave the young person alone until after they have been assessed. It's important to supervise them at all times. By talking directly and compassionately with a young person about their concerns and thoughts about suicide, you're sending the message that you notice, you care, and that you're going to help them. Even if a child is not having thoughts of suicide, that you're going to be reassuring to them that they have an adult that is caring and wants to listen to them and wants to help them. Also, if you get a report that a friend of your child or another young person is feeling suicidal, it's helpful to contact either their school or their parents, but contact someone and tell them what you have learned. And of course, if there's an emergency, such as a suicide attempt in progress, it's important to call 911. These resources are available 24/7. Again, I mentioned the National Suicide Prevention Lifeline. You can call 800-273-TALK, or you can simply dial 988 and be connected 24/7 with a trained counselor for anonymous help. You can also use the crisis text line, which is another important resource. This is not just for young people. Older adults can use this as well. But you can reach the crisis text line by texting the word TALK to 741-741, and you'll be able to text directly with a trained crisis counselor. I will also just mention that if you are with somebody who is in a suicide crisis, you can call the Lifeline, or you can text the crisis text line for that person, and the trained counselor will help you kind of walk through the next steps to help keep that person safe. Remember, talking honestly and openly with young people about suicide can save lives. And all it takes is one caring, compassionate adult to take notice and start the conversation. And hopefully that person is you. If you want more information about our programs at the American Foundation for Suicide Prevention, you can visit our website, afsp.org. Our Wisconsin chapter has a site at afsp.org/WI. We post all of our trainings and our awareness walks. We do have a number of events coming up in November for our loss and healing for suicide loss survivors, including our International Survivor of Suicide Loss Day, which is coming up in November. You can find that information on our website. Together, we can create a culture that's smart about mental health, will save lives, and vastly improve the lives of many more. Thank you so much for attending the presentation. I appreciate it, and good night.